Well, we're having a beautiful day here in the Chicago area. I'm out and about and doing a little bit of walking out here in the great outdoors, out in one of our local parks. And I hope you're doing well. Stay tuned. This is not going to be a long video. I'm Dana. In case this is the first time you've joined me. Hi my friends, I'm Dana. Hey, hope you're doing well. We talk on this channel about weight loss, using weight loss medications to help us, like Mounjaro, Ozempic, Wegovy, Zepbound, all the medications that help. We also talk about foods that are good to eat. Also any latest news about weight loss or things in the news about weight loss and the medications and things. I've just switched this past week from the Mounjaro to a compounded form of tirzepatide, the same strength. So I'm still trying to see how effective it is and to see if it's as effective as the medication in the pen. I've been using the quick pen, and now I've gone to the compounding. So I'll let you know on that. I go through a telehealth agency, medical telemarketing, or I go through Lavender Sky, who they have an association with Hallandale Pharmacy in Hallandale, Florida. And it has been interesting to see about saving money by doing it, because I think, and I'm at 5 milligram normally with Mounjaro, so I got the equivalent in tirzepatide in the compounding, and it was about $350 for 2 months. So that's not bad. That's about $175 a month. I'm out here in the great outdoors. It's a beautiful day in Chicago. See if I can pan around here a little bit so you can see. I'm out in the wooded area. It's a park. Nice, beautiful park here in Northwest Illinois, about an hour or so out of Chicago. And I thought it would be a good opportunity to do a video. I'm due to do one. And hope you're doing well with your weight loss, and put comments. Also like and subscribe. It's really good for the channel, helps me get my message out to get more subscribers. And if YouTube sees that people are watching the videos and liking or subscribing, it tells them to push it out to more people, which really helps me and helps the channel, you know. And I'm not monetized. I don't get any ad revenue, but maybe one day I'll get a little bit, maybe a few dollars here and there. You know, I'm retired. Anyway, I wanted to talk about, and I know we have people viewing from all over the world. Now, this area I'm talking about for a few minutes here right now will be about Medicare, which is primarily in the United States, and that's normally for people 65 and over. There's been some confusion and some changes. Originally, CMS, which handles Medicare for the federal government, and the administration worked out some agreements with Eli Lilly and Novo Nordisk to supply weight loss medications, because obesity in the United States is really a big problem. I think something like 7 out of 10 people are overweight or obese, and you know, we all know that adds to other health problems. Heart attacks are possible, strokes, high blood pressure, diabetes. So I applaud them for making the move to try to make it more accessible for people. How it was worked out initially is to have 2 programs, one called Bridge and one called Balance. Now the Bridge was basically to get it started, and Medicare was going to take on the financial cost, and it was going to lower medication price down to $50 for seniors in Medicare. And then the balance program, and now this bridge was just supposed to go from July 1st, 2026 through December 31st, 2026. And then after that, starting January 1st of 2027, a program called Balance was going to start, which was more involved with the Plan D pharmaceutical plans, the drug plans with the, like CVS, United Healthcare, Caremark, Walgreens, all the different benefit managers that worked with the Plan D Medicare insurance programs. Now, a couple of the biggest ones have said that they don't think they can do it financially, and they want to review it, and they're not committing to do it. So Medicare has said, because initially they got 80% of the Plan D providers for the drug coverage for Medicare to agree that they would cover it, or maybe just consider covering it. So when they got 80% with CMS or Medicare, they went full steam ahead. Let's do it. 1 year starting January 1st, 2027 till the end of December 31st, 2027, to do it through the benefit providers. But now they've mainly CVS and US Healthcare. CVS said they don't want to be involved in it because of the cost. And United Healthcare has said that they're still reviewing it. They're not sure yet if they're going to make a commitment to it. So what Medicare has said was that they're going to extend the bridge program not just from July 1st to December 31st, 2026, but they're going to extend it for an additional year from January 1st of 2027 through the end of 2027, which is good. And that should lower the price of the medications down to $50 per month, which is more affordable, especially since most people on Medicare are retired and, may have limited funds to pay, the high price of the medications. And, obesity is an illness. It's not something you decide, oh, I want to be 300 pounds, I want to be 400 pounds, I want to be 250 pounds. It's not something that gets elected. It's what's, your influences, your genetics, different things. And the medications have been found to be helpful. So wanted to do an update on that. Also in the United Kingdom, I believe they've approved the higher dose Wegovy pill, the higher dose Wegovy injection that is now in one pen. Initially, when they were testing it, it had to involve 3 individual injections in the same day to get the higher dose. And I believe they've manufactured the quick pen in the higher dose to do 1 injection once a week, which is good. And I believe that's available now in the US. Also for Zepbound in the US, it's now available also in the quick pen, which is what I got in England, which is widely used in Europe, which makes more sense. Instead of having 4 individual pens, 1 a week with all that extra plastic and manufacturing, the US has gone to the quick pen, where you just have 4 disposable needles you put on, 1 for each week, with antiseptic wipes. And you don't have all the manufacturing costs of 4 different individual pens for a month. You have the 1 pen and you dial it for a dose for each week, which is a lot more cost effective, should bring the price down. And I'm hoping, and there's a lot of medications that are being tested in the pipeline. So I think in the next year or so, we're going to see some other medications come out as competition. Now the retatrutide is supposed to be excellent, supposed to be even more powerful than Zepbound, but also it's owned by Eli Lilly, so they're kind of competing with themselves with Zepbound versus the retatrutide. But we'll see what happens with the pricing. Maybe if they can work out deals with these pharmaceutical insurance companies and things and get the price lowered but get the volume, maybe it's going to make it more accessible for everyone. And it's a good sign that Medicare is getting involved in that, because once they get involved, then I think it's easier for the other insurance companies to study the results and to get involved, because that is going to help the overall health crisis in the United States with the obesity, because so many of our foods have a lot of added sugar, high fructose corn syrup, salt, which is good. Now, when I'm filming this, we're in the middle of April of 2026. There is a war going on in the Middle East. You may watch this later, and hopefully everything's been resolved peacefully. But there is tension now, and there are worries about the war that's going on in the Middle East, and that is raising prices on everything from gasoline, petrol, to jet fuel and fertilizer and liquid natural gas. So we're hoping all this gets resolved and that we have peace in the area, because we all need to live together, you know what I mean? So anyway, I'm going to wrap this up. Just wanted to do a video and get you caught up. I'm doing well. You know, I've been losing about a pound a week, which I'm happy with. I'm happy to see these medications get approved. The newest one, as of the filming of this, is orgliflozin, also known as Foundayo. And the benefit of that, again, it's a daily pill. You take it once a day. There's no restrictions on food or water with it. And it is helping people. And I think I saw the first week or two, they had, I don't know, I think like 170,000 prescriptions filled for it, or 100,000. Anyway, it was a lot of prescriptions filled. And that really is good, especially for people that don't like the needles. And it is helping people. It's not as effective as Zepbound. And also it kind of matches, I think, the results on the Wegovy pill. The Wegovy pill is another one that's available without an injection, which is a daily pill. And so I'm glad these options are out there. I want to thank you for watching the video. Like and subscribe if you can. And good luck with your weight loss. It's not easy and it can be expensive. And I'm glad also to see that the NHS is making the benefit of the weight loss medications available to more people. I'm sure there's more people that would like to be in the program there to take advantage of it than can get it right now. But it's a positive sign that they're starting to let people in England, United Kingdom, go through the NHS to get help with the medications and weight loss, because it does help the overall health to, you know, eliminate a lot of the other potential health problems. So it should lower the health costs in general. But anyway, thank you for watching. You have a great day. Good luck with getting that weight off. We got to work on it. Thank you very much. Well, I see there's some display here. Display on some of the wildlife in the area. And let's take a look at it and see what we can see here. We have raccoons. It says, raccoons are closely related to the panda bears. They're very agile and can climb trees backward and forward. Our champion swimmers and can fall 35 feet without getting hurt. And raccoons will eat almost anything, plant or an animal, dead or alive. And they especially like trash cans, garbage cans, or garbage bins. Okay, and the next one on the board here that's in this wildlife area, this is about the possum, which I don't think they are the prettiest animal. Virginia possum, or some people opossum, is North America's only pouched animal, or marsupial. Possums are not aggressive and play dead if they are threatened. They use their tails to carry bundles of nesting materials and have opposable thumbs on their hands and feet. Now that's interesting. Also, I lost my microphone here.